Good morning, everybody. My name is Christina, or I call me Tina. Now, I'm a nurse, a registered nurse, and I'm a public health nurse. So, now, we are going to be talking about postpartum hemorrhage. So, now, what is postpartum hemorrhage? Postpartum hemorrhage is defined as an excessive bleeding after childbirth, specifically 500 ml loss after vaginal delivery. So, when you're talking about postpartum hemorrhage, it's loss of blood, like severe, excessive loss of blood. So, you use the word excessive or severe loss of blood, which is 500 ml after vaginal delivery, and 1000 ml blood loss after cesarean section. So, can you get the difference? Vaginal delivery is 500 ml loss of blood, while cesarean CS is 1000 ml. So, you can see the difference, alright? So, okay, types of postpartum hemorrhage. We have primary, which is known as early postpartum hemorrhage, which occurs within the first 24 hours after delivery. It occurs after 24 hours after delivery. Then we have secondary, which is called late postpartum hemorrhage, which occurs 24 hours to 6 weeks postpartum, that's after delivery. So this secondary, it occurs late, while this primary occurs early. This secondary can occur between 24 hours. Then we have causes of postpartum hemorrhage. We have uterine atony. Uterine atony. Most common causes, uterus fails to contract. When uterus fails to contract, go back to its normal position. It causes postpartum hemorrhage. Then we have retained placental tissue. We have lacerations or uterine rupture. Lacerations as cuttings, or when the uterus ruptures, it causes postpartum hemorrhage. Coagulation disorder, that's another problem that causes. Now we have the risk factors. That is some things that can lead to the likelihood of this postpartum hemorrhage occurring. We have prolonged or rapid labor. Prolonged labor, as you know, is a labor that took time, that takes long. Rapid labor, a labor that occurs faster than expected. Then we have overdistended uterus. That is a uterus that has overstretched or expanded more than normal during pregnancy. Then we have high parity. That's a woman that has had multiple previous births. We have previous postpartum hemorrhage. We have use of forceps or vacuum. We have induction of labor. We have placenta previa. So this placenta previa is a condition in pregnancy where the placenta is abnormally implanted in the lower part of the uterus, partially or completely covering the cervix. While placenta abruptio, it means a condition where the placenta separates prematurely from the wall of the uterus before the baby is delivered. So these are the things that can lead to signs and symptoms of postpartum hemorrhage. We have heavy vaginal bleeding. That's whenever you notice a heavy bleeding that can lead to use of how many parts, you should know that it's postpartum hemorrhage. Low blood pressure, increased heart rate, pale, cold or clammy skin, dizziness or fainting, uterus that feels soft, pudgy on palpation. During palpation, when the uterus feels soft, very, very soft, you should know that it's a sign or a symptom of postpartum hemorrhage. So you should be aware. Then we have management, how this postpartum hemorrhage can be managed. Nursing management. We have initial response. Call for help. Number 1. Once you notice this bleeding, you call for help. Monitor vitals, checking of BP, checking of heart rate, checking of temperature. Ensure IV access and start fluid resuscitation immediately. For the medical management, uterine massage. You massage the uterus and document whatever you notice. Uterotonics. Example, oxytocin, misoprostol, egometrine. You administer these drugs. Removal of retained tissue. Treat trauma and coagulation issues. Then for the surgical management, if bleeding persists, then these surgeries will be carried out. Uterine artery ligation, hysterectomy, uterine tamponing. Thank you for watching. Please like, comment, and subscribe. Thank you.